Summerby throws a heavy hit on Cameron Easy.
The big hit is an integral part of contact sports. It's one of the reasons we watch. But in recent years, the growing awareness of concussions and their dangers has changed the way all sports are played, watched, governed, and treated.
I think we hit the point where everyone recognizes how dangerous it can be. Especially with these new numbers coming out with the CTE and other effects we're learning that concussions can cause. I feel that we are doing a great job now by providing coverage and recognizing the signs and symptoms of concussions so that hopefully in years to come, when they do these studies over again, we'll see those numbers decrease.
Though there is now widespread awareness about the threat that concussions pose, there is still important information that many people misunderstand or simply don't know, starting with what concussions are and how they happen.
So a concussion is defined as a mild traumatic brain injury from a force blunt trauma to the head, and what most people don't know is can also happen from non-force. So like in a car accident or someone falling on the ground, they don't necessarily have to hit their head. Their head can be whipped back and forth, what we call whiplash, and that violent force can shake the brain so much that it can cause a concussion.
While awareness of concussions and their long-term effects is up, there is still a lot of work to be done in the care of people with these injuries.
The strides that we do need to make is that we need to make sure that there's more access to services for individuals with survivors. Some survivors have access to physical therapy, speech-language pathology, and community services. There are other survivors that don't have access to rehab and support. So we really need to keep pushing to make sure that all brain injury survivors have access to support and services, and that they have connections in the community to help them recover.
It is estimated that up to 4 million people sustain concussions in the United States each year. The good news is that the recent publicity has sparked a new wave of research and treatment. Boston's Spaulding Rehabilitation Hospital is one of the leaders in this area.
We have a vibrant, diverse, highly productive research program in sport-related concussion. Clinically, we see athletes, youth athletes, who have complex problems following this injury and who are slow to recover. And our goal is to help them have a safe, swift, effective, and durable return to school, to sports, and to life.
We're a part of the Football Players Health Study at Harvard. We also have an NFLPA MGH Trust-related center where we see former players and evaluate them. We're a part of the Red Sox MGH Home Base program, which evaluates our nation's heroes who have traumatic brain injury and PTSD. Most sentinelly, we've been a part of funded networks that focus on treatments, diagnosis, and new therapies.
So our goals at this point are to try to standardize the approach to both assessment and treatment. Because there has not been very good standardization, it's very difficult to learn from our mistakes, for example. So there's much more of a focus now toward operating the same way so that we can then be able to compare results across studies, across states, and across countries even.
Coming up, we'll find out more about the unique research being done at Spaulding, plus hear the remarkable true stories of some local concussion patients. Stay with us. Certainly, sports concussions have gotten a lot of attention over the past few years, which is a very good thing. But what has not been as public is the incredible personal toll these injuries can take.
My injury occurred April 18, 2010, and I was one of the bases hoisting up our flyer in the air. And our flyer, she bailed out of the stunt and fell to the side, her rear end, hitting me in my chest, causing me to fall back down to my own rear end. I had suffered a subdural hematoma along with a fractured C7 vertebrae in my neck and a collapsed lung. So I was rushed to the hospital and I was immediately brought in for surgery. I was in a medically induced coma for 2 weeks and the intensive care unit for a total of 1 month. And then after that 1 month, I was moved to the old Spalding Rehab Hospital.
One of the most misunderstood things about traumatic brain injuries is the extent of the damage they can cause. In Ryan's case, it affected literally every aspect of her life and made rehabilitation extremely difficult.
Cognitively, my short-term memory was the most severely impacted and damaged in my injury, which of course played into everything else. I had to relearn everything we learn in preschool and kindergarten, washing my hands, brushing my teeth, feeding myself, very guarded steps with a walker. A brain injury is not just like a broken arm or a fractured ankle. You can't just strap a cast on it, go to physical therapy sessions, and then be all better, good as new. So it's just finding different ways to work around and work through and overcome.
Fortunately, Ryan has an indomitable spirit. So with the help of her family, the professionals at Spalding, and other rehab facilities, she gradually recovered and got her life back on track.
Reclaiming what had been taken from me in my injury, that was one of the main motivators and factors in my recovery. I returned to college for the fall of 2011, and then I graduated May of 2014, only 1 year behind when I was originally supposed to.
My name's Charlie Andrews. I'm a student at MIT studying mathematics with computer science, and I'm involved with a sport called American Ninja Warrior.
Andrews has yet to lose in this competition.
Yeah, I was really excited when I found out that I would be able to compete on American Ninja Warrior because I dreamed about doing it since I was a kid.
Andrews out first, but they are close.
I finished the course in the LA qualifiers, which I was really excited about, and I had some close family members and friends cheering me on, so it really meant a lot.
Charlie had such a great experience on American Ninja Warrior that he wanted to return. So he started his training again, which included parkour and rock climbing. It was in one of those training sessions where he fell and suffered serious head trauma.
It differed significantly from other injuries because a lot of the symptoms are quite hard to place or connect with the fact that the accident took place. Suddenly, different things like stepping up onto the curb of a sidewalk became something I need to stretch out both hands for. I also had some difficulty, especially at first, reading and looking at screens, and light sensitivity and sound sensitivity were issues as well. Being able to sleep through the night became difficult.
To deal with his symptoms and hopefully return to his studies at MIT, Charlie started rehabilitation at Spalding.
Once I got to Spalding, I was seen by multiple specialists. Largely, my cognitive skills were not affected, but different things like coordination and balance were suddenly very difficult. So all of these different things were things that I talked about with my doctors at Spalding that I made a note of, and they became sort of items in a to-do list of things to regain. I've really enjoyed being a patient at Spalding. I've been on a first name basis with pretty much all of my doctors and clinicians here. They were a little bit surprised that I made an appointment on my birthday, specifically, but I actually wanted to go in for physical therapy.
Nice. Woo!
Immediately after my injury, I had to cancel a lot of plans and reset my expectations. But at this point in my recovery, with the help that I've received from my doctors and family and friends, members of my community, I'm at the place where I can start making new plans, and I'm really excited about that.
My name is Madeline Uretsky, and I'm from North Reading, Massachusetts. Before my injury, I was playing 4 sports for my high school. I was a soccer player, I played ice hockey, and I did 2 seasons of track. And I really, really loved it. I was at my high school, I was very involved. I was in the leadership committee, a straight A student, and I really just enjoyed going to school and being on a team and being a good teammate.
While playing soccer as a high school sophomore, Madeline suffered a serious concussion. She didn't lose consciousness or require immediate medical attention, but within a few hours, severe symptoms began to emerge, and her life was changed forever.
I had short-term memory issues. I have had a headache nonstop the past 6 years. I've had neck pain, dizziness, sensitivity to light and noise, and the sensitivity to light hasn't gone away yet. And then additionally, I've had some different taste issues. I couldn't taste bitter, which I found really interesting. I also have had a decreased immune system, so I've gotten sick a lot more. And I've had a lot of problems with my eye movement. So my official diagnosis has been post-concussion syndrome.
The physical and cognitive disabilities were obviously big problems, but for a straight-A student, athlete, and a teenager, they led to a host of further issues.
I wasn't able to drive. I got my driver's license late. You know, when all my friends were driving, I couldn't go to school dances, sporting events. People thought I died. They hadn't heard from me, they hadn't seen me, they didn't know what was going on. I lost a lot of friends because they just couldn't understand. When I got back to school, I would get all of these questions. You know, you look great. What went on the past couple months? And it was really hard to explain to people.
So I think especially with parents, one of the things that helps is just to accept the fact that this is the way it is for now, and you have to work at getting better.
With the steadfast support of her family, Madeline began that hard work, visiting rehab facilities, doctors, therapists, and doing whatever it took to reclaim her life.
Depending on how severe a concussion is and what symptoms you have to treat the symptoms separately. I've now seen over 24 different practitioners of all different types. So at Spalding, I saw a social worker who specialized in working with people with brain injuries, and she told me that I'm such a competitive athlete in person that I'm going to need to put my energy somewhere else because I can't play sports anymore. And so that's how I turned to advocacy work. And it's really helped, and talking to other people who've gone through something similar has really been helpful, and talking to other parents. I really enjoy talking about it because I know how hard it can be, especially for somebody so young.
Down and brought on by Shifley.
Awareness about concussions and their long-term effects is a good thing, but it is only the beginning. Discovering more about these injuries, diagnosing them, and the best ways to treat them are the next steps. Boston Spalding Rehabilitation Hospital is at the forefront in these fields.
Spalding is one of 16 traumatic brain injury model systems. This is a program that's funded by the federal government. It now is home to the largest longitudinal database in the world for individuals with moderate to severe traumatic brain injury.
And they're very important to us because they represent linchpins in our research for people with brain injury, spinal cord injury, and burns. They represent a longitudinal data set, something we're following for a long period of time, and we're better able to categorize people. We understand a lot more about who people were when they started. We understand a little bit more about the biology of the disease, issues regarding cerebrovascular reactivity, problems that we're able to now diagnose via blood tests or some early initial findings that make that very interesting. Unique imaging that shows us damage in certain pathways.
In addition to the National Concussion and Brain Injury Research at Spalding, they are also doing their own important independent studies.
We're doing a tremendous amount of research in the area of sport-related concussion right now. One area that we're studying is outcome from this injury in high school students, whether there are certain risk factors that contribute to either slow recovery or more complicated recovery following this injury. Some risk factors to consider might be whether the student athlete has a learning disability or ADHD, whether that athlete has a history of migraine headaches, whether that athlete has a history of multiple prior concussions. We have a program of research that's designed to look at all of those factors and try to determine which factors, singly or in combination, are related to how quickly you recover from this injury.
What I think is unique about this approach is is its interest in the individual person. So we've been trying to use a magic bullet, treating everybody as though they all have the same brain injury and they can all benefit in the same way, but that's not going to be possible. We know that now, and I think this more unique approach will attempt to really focus in on more precisely that individual, and then that will help target the type of interventions that are most likely to benefit that individual.
Ultimately, the bottom line of all this research is better prevention and more effective brain injury treatments. And that has definitely been happening.
I think the spectrum of treatment for concussion has really changed. We had a history of really just sending people back into the game, and then this brief over the last decade and a half shut everybody down, put them into darkness. And the probable real answer is we really don't want people who are symptomatic returning in any way to the game. But we also know now that these prolonged periods of darkness, these prolonged periods of rest, may not be beneficial nor necessary.
It used to be, if your kid sustains a concussion, you wake them up every 10 minutes, you don't want them to black out or pass out. Now, we encourage them to let them sleep. When that brain shuts down, it has time to heal. Just like with any other injury retreat, we want you to rest it, and that really helps with the process. And then new therapies, we do a lot of vestibular therapies, balance testing, and that kind of stuff we have learned kind of helps with the recovery process.
The end result of all these new treatments is better outcomes for brain injury survivors, like the Spaulding patients from our earlier case studies, who are now active and on to bright futures.
My number one career and life goal is to be a television news broadcaster, and I will not stop until I get there, and you will see me. Good morning, America. I'm Ryan Farrell.
Once I got hurt, I started to learn so much about the brain and my own brain, and I found it fascinating. And so I'm currently in college. I'm going into my senior year. I'm a neuroscience major, and I'm double minoring in nutrition and biostatistics. And eventually I'll be pursuing a PhD in clinical neuropsychology. I really want to be a professor to be able to educate people about the brain because it's so interesting.
I'm excited about returning to school in the fall, finishing up my degree, and learning a little bit more about brain sciences on the side. I purchased a book on neuroplasticity since it's something that is especially kind of given me a lot of hope in the recent past, because brain injury is something that we can recover from, and that's very exciting to me.
One innovative program that has been making a big difference in youth sports concussions is Spaulding Rehab, providing full-time athletic trainers at some high schools in Massachusetts.
Yeah, so we're at the high schools every day from when the last bell rings to the last practice or game ends. It's not we just don't show up at a game and cover it and make sure no one gets hurt and then leave. We become part of the school community and we get to know our athletes. And by doing that, the coaches trust us, the parents trust us, and the athletes trust us. So they know if we come up and say, hey, this kid needs to come out of the game, we need to look at them, or their son or daughter hit their head pretty hard, they should really get checked out. They trust us, and they go along with that.
Having full-time professional athletic trainers at high schools is definitely helping diagnose and treat athletes with concussions. But perhaps even more important, they are helping prevent them from happening at all.
I feel Spaulding's leading the way with concussion prevention by having athletic trainers and the physical therapists and our sports physicians. We work so closely together that we mold ourselves in the communities we're in, and by doing that, we feel that we can help prevent these traumatic brain injuries.
There have been many positive developments regarding concussions and traumatic brain injury, but much work still remains to be done.
The most important things, I think, come from a public policy standpoint, that there needs to be more education and awareness to make sure that when someone does have an injury, that they do get linked up to the Brain Injury Association, other hospitals and other providers to make sure that they have early, often, and access to support. But I think the most important thing is that there needs to be more legislation and public policy in place to try to prevent injuries.
I don't think there's any way to prevent a concussion right now, but what you can do is educate yourself as to, does my child have a concussion? Do I think they have a concussion? If you suspect it, you have to go seek treatment, find out if it is an actual concussion. You have to then do something about it. You can't just ignore it.
Unfortunately, concussions will always be a part of sports. But the good news is that things have improved immensely over the past few years, and the future is even brighter. Spalding Rehabilitation Hospital is uniquely positioned to continue making advances in brain injury, concussion awareness, prevention, treatment, and research.
Some of the things that separate Spalding from many of the other rehabilitation hospitals are, again, first of all, the academic environment that we live in. We have so many top-shelf academic institutions, medical centers, universities in such a compressed area, and they've been tied together so well.
From my perspective, I'm just more excited about the future that I could possibly be. I think Spalding is among the most unique institutions. And I think it's the breadth of people we see, but it's very much more than this gorgeous building. It's the passion of the people we work with. It's the remarkable dedication that you find on a Saturday night here at an untoward hour where people are working on projects, not because they have to, because they care. I don't think there's an environment like it in the world.